going to be doing an extraction here, taking the tooth out. First, I'm going to disinfect my hands. I'll take a look at the x-ray. And she needs a wisdom tooth extracted. This x-ray is a little off-center, and I don't see the detail I want to see in that. I'm going to take a look in the mouth. We have Elizabeth here, and there's some gum swollen around her wisdom tooth. We're going to take a individual periapical x-ray of the tooth so we can get a kind of detailed look at it. I'm going to numb Elizabeth up here. We use some topical anesthetic. We use a pulse oximeter to get her pulse and oxygen saturation. That's more important with people who have cardiovascular or respiratory problems, or when we're doing sedation. Also going to get a blood pressure. We don't expect to find too many problems with a young healthy patient. Her blood pressure was normal. Give Elizabeth an injection with lidocaine 2%, painless injection with a thin needle. Elizabeth is doing well here. She used to be very, very phobic, but she's doing a lot better now. We're going to have her sign a consent for the procedure. More importantly, we explain to her beforehand what we're going to do and what potential complications there are going to be. This is the small x-ray, the periapical x-ray of the area. You see the wisdom tooth on the far right, and it is partly covered or impacted with tissue, not in good position. I'm going to use a little articaine 4% around the tooth. I'm going to number up a little bit extra around the tooth, and that really helps make sure she really feels no pain at all during the procedure. And we like to do this while she's already a little bit numb, and then I just give a little extra just to make sure that she feels absolutely no pain. And she's doing fine. Take a look in there. I'm going to use a straight elevator. I'm going to rock the tooth with the straight elevator. Now I'm going to use a larger elevator, a larger straight elevator. And I'm going to continue to rock the tooth. Now I'm going to use a lower forceps, and I'm going to rock the tooth with the lower forceps and gentle pressure, and the tooth is out. I'm going to irrigate with chlorhexidine gluconate to make sure everything's clean in there. Compress the area, have her bite on gauze, and that's basically it.
I didn't feel a thing. I didn't even know it was out. Did it? No.
Okay. You did super with everything.
That was great.
It's hard to believe 5 years ago she would hardly let me do a filling on her. Now we did an extraction of a wisdom tooth without any problem, and she did super. I'm going to go over some post-operative instructions with her now, just for the next 24 hours. I don't want her to spit or rinse or smoke. I don't want her to eat anything too hot, spicy, or crunchy. I want her to eat on the other side of her mouth, all for the next day. And she'll bite on the gauze so the bleeding stops, and change up that gauze every 20 minutes.
Now I'm not going to hurt anymore.
I'm going to give her a little medication for pain just in case, and that's it. She did fine. People afraid of having their tooth extracted or having their tooth pulled. You know, this is a patient who would barely let me do a filling 5 years ago after she overcame her fear. Now she did fine. No problem.
I just got my tooth pulled out. It didn't hurt. I didn't even know it was out until it was gone. It was great.
Here with Richard, and we're going to, again, need to do an extraction. And he has a infected tooth that's connected to a bridge, which is really 3 joined caps. And he also has a cavity on his wisdom tooth, but the wisdom tooth is okay. We're going to try to save that tooth. We're going to put some topical anesthetic on the gum. Get a blood pressure here on Richard. Richard is borderline hypertensive, but he is okay to have this procedure done. We'll ask him to follow up with his family doctor afterwards. Again, we'll put the pulse oximeter on. I like to see a reading of 95 or higher on the top number. It's at 94. We want him to breathe a little more. There we go. Pulse is okay. It's steady. Again, the pulse oximeter are more important for people with cardiovascular or respiratory problems. And we're going to do a injection with lidocaine 2% to numb it up. Stephanie helping me here. The first thing I'm going to do is I'm going to actually section or cut his bridge away from the area that the tooth needs to be extracted. But because there's 3 teeth on the bridge, the front tooth is salvageable, so we're going to maintain that while extracting the fake tooth and the tooth that we're going to be removing. I also removed the decay on the wisdom tooth not connected with the bridge, and we're going to put a temporary filling in that tooth for now. After the teeth are out, we'll decide what we're going to do on that left side. Now we're just injecting around the tooth with Articaine 4%, and we're just like we did on our other patient, we're just going to inject around the tooth just to make sure Richard is absolutely numb. The most important thing is that the patient feels no pain during the procedure. So you got to use the right amount of anesthesia so that the patient is completely numb. So just continue to inject here. Continue sectioning the bridge. Stephanie helping us here, suctioning everything for us. Now that the bridge is sectioned, I can use my straight elevator to loosen the tooth. We're going to loosen it from both sides. I'm going to go from the outside of the tooth. We're going to use the larger straight elevator, and we're going to go ahead and continue to rotate the elevator to loosen the tooth. Now we're going to use a lower forceps to gently rock the tooth, steady pressure to take the tooth out. Richard's doing fine. He's not having any problem here. Keep rocking. And the tooth is out. Okay, the tooth is removed. I'm going to irrigate again with chlorhexidine gluconate. Just make sure everything is clean inside the socket. Compress the socket. Get the bone back to where it was. Notice the tissue is a little bit flabby. He's going to need a couple of sutures, a couple of stitches there. And there's the tooth that came out, and there is the crowns to the left of it. If you can look at the x-ray, it's the very first tooth on the far left side. And I'm showing you on the left side where the back root has decay and a break through it. That's why the tooth had to be extracted. That's why it wasn't salvageable. Now I'm getting my sutures, my stitches ready. We're going to use a gut suture. And these sutures or stitches dissolve on their own, so he will not need to come back to have them removed. They'll come out on their own, although we will reevaluate them in a week anyway. So we'll go ahead and stitch that up. Just blot the blood out so I can see how he's doing. And he's good. A little warm towel. Have him finish up with. No problem. No pain. Hardest part of this procedure for him is knowing where to wipe up because he's still numb there. Okay. You didn't feel anything when we pulled the tooth, right?
No.
Okay. So he did fine. 24 hours. And again, if you're afraid of having a tooth pulled, you watch these two patients. Again, these are not actors. This is live. You know, these are patients I would see every day in a practice, and it's generally how it works out.